For those who don't know me, my name is Debraj Shome, and we run a chain of clinics called the Aesthetic Clinics, and it's my pleasure as the chief instructor of this course to take you through combination rejuvenation, which we perform for aging faces. Certain financial disclosures are in place. I'm a faculty at Allergan for the past 15 years, at MERS for the past 15 years, and also a faculty with Aptos, which produces the threads which I used in this particular presentation. Now, we all understand that the OG curve is something which denotes youth. When you look at a youthful face, especially at 45 degrees, you're able to see a S-shaped curve of the face. This is what is an OG curve. However, aging destroys the OG curve. So essentially, what is aging? This slide actually is possibly the fulcrum on which the entire presentation is based. If you understand this, you will understand everything post this. Essentially, aging is Mother Gravity being ever so kind and Mother Gravity pulling all of us downwards and medially. And as our facial tissues slide downwards and medially, we get the tear troughs which develop under the eye, and we also get the nasolabial folds which develop. Why is this important to know? Because some people tend to mistakenly believe that fillers are something which is like tar, it's like coal tar. Wherever you see a depression, go and fill it up. Like you see a pothole on a road, you put coal tar, similarly you put it in. But that's not true. Why is it not true? Because remember that this tear trough deformity developed because everything sagged down. And unless and until you can lift everything up, you'll never get the tear trough deformity working well. Now, there are also certain changes which occur as we age. As men go into their 4th and 5th decades, the testosterone levels, which is the main male hormone, tends to go down. Ditto for women as they approach menopause. What happens is essentially the fat starts to get redistributed in the face. Initially, the superficial fat is more. That tends to start to disappear as you age. Initially, also in youth, the deeper fat is less. That tends to increase as you age. So essentially, what is aging? Aging is a grape losing all its volume and becoming a raisin. So if you think of that analogy, you will understand that volumization is something that becomes critically important in making faces look younger. There are also changes which occur in the bone. And what is happening is your bone is undergoing resorption all the time. Think of your facial soft tissues as if they are a bed sheet on your bed. So what is happening as you age is the bed is becoming smaller, and as we are gaining weight, most of us are gaining weight and becoming heavier as we become older, the bed sheet is becoming too much. So as a result of which, you have too much bed sheet and too little bed, and that's also the problem. So think of fillers as a way of augmenting the bony skeleton. Think of fillers as a way of contouring the face. Do not think of fillers as going ahead and just filling up depressions like you fill up potholes with coal tar. And that's the reason you find so many people looking funny on television. Fillers don't make people look funny. It's doctors who don't know how to use fillers who make people look funny. Now, this was the first aging paper which came out of the aesthetic clinics. In fact, it's the first aging paper which came out of India. Until this paper was published in 2018 in Plastic and Reconstructive Surgery, which is basically the flagship journal of the American Society of Plastic Surgeons. Until then, we did not have any data on how Indians really age. If you don't know how Indians age, how will you treat them? But that was exactly what was happening. We were treating Indians and their aging based on what Caucasian instructors were teaching us, and we were obviously going wrong with that. Now essentially, whether you do phacosurgery, you do refractive surgery, disease recognition as a doctor is ultimately pattern recognition. Aging is also about pattern recognition. Try and see if you identify some patterns on these faces. What happens to this face at age 23? What happens to this face at age 37 in this serial photographic study which was performed at age 71 and at age 76, right? Let's do the same here at 20 through 45 and then going on to 51. See how the lower face is looking older and older. Look at how the cervicomental angle or the angle of the neck is becoming more and more obtuse. Look at how certain things are changing even in men, especially with men losing hair, how the upper part of the face is aging. This gives us some sort of an understanding. The first thing which we understand is, in Indians, because of the melanin in our skin, the upper third of the face ages reasonably well. And if the upper third of your face ages reasonably well, and botulinum toxin is something which is performed in the upper third of the face, India is not Botox country. So people tend to mistakenly believe that facial aesthetics, I know how to inject Botox. Sorry, that's not even 10% of facial aesthetics. The mid face and the lower face are the real problem areas. It is the neck, the loss of definition in the jawline, the lower face, which really becomes a problem area. Like I said, it's the bed sheet becoming too much and the bed reducing in size. So let's look at some patients, right? I mean, because we have limited time, this is really a 45-minute talk which we need to condense into 25. So let's look at some of these things. Now, this particular lady came into us, and I appreciated if pictures were not taken of patients. Thanks. So we have this lady who came in, and this lady wanted to go ahead and get her right and left sides of the face treated. You may note very clearly that the right and the left eyes don't look the same. There is an inferior scleral show on the right side, which is not there on the left side. The right eyebrow is also higher. When she smiles, this becomes even more accentuated and the left eye becomes smaller. She had been to numerous plastic and oculoplastic surgeons who had suggested a ptosis surgery of the left eye. But my question to you is, if at all the palpebral fissure is different by 0.5 millimeters, are we good enough surgeons to correct palpebral fissure heights of 0.5 millimeter differences? And are we good enough to correct it with predictability in all our patients? If the answer is no, and I'm not that good a surgeon, so if the answer is no, then the answer would be to treat it predictably with toxin and fillers. So we did a couple of units of botulinum toxin out here, which is used to flatten the hypertrophic orbicularis oculi roll, the roll which when you smile causes the eye to become smaller. And then we did a little bit of filler out here, and that's how the patient looks immediately after. So you took her from here to there, where now she's smiling, everything else remains the same, but the under eye and the eyes look much more symmetrical and look transformed. The fillers are going to last approximately 2 years or so. The botulinum toxin will last only 3 months, that's true. But then the botulinum toxin also is only 2 units. It's going to cost us 700 rupees as opposed to a ptosis surgery, which might have been much more risky as well as difficult to perform. Let's look at another patient. A 46-year-old patient, madam, if you would not record the patient these things because of patient privacy, thanks in advance. 46-year-old lady, and when we look at faces, we should also try and understand what's happening to their brains. She came into us, she wasn't interested in looking younger. She wanted to know if she could look more energetic. She wanted to know, she said, I'm at the pinnacle of my career. I'm a CEO in a top company. I want to look younger. I want to look more rested. I want to look more rejuvenated. And I definitely don't want to look tired. People think I look tired. When she smiles, you can see why she's looking tired. And this is a patient who's been on follow-up with us for the past 15 years almost. At that time, when we started off our treatment, we had only one filler in India, which is the Juvederm Ultra Plus, which was a very substandard filler. But even with those substandard fillers and botulinum toxins, you can create miracles. You can create patients who look like this. So if you can create this sort of difference without performing surgery, why then do you need to perform surgery, especially if it's only a 30-minute procedure? You will also get patients like this who have a nasolabial fold and who have a very light fold. Now, in a Caucasian patient who have a very light fold, this is very easy to treat. This could be done by anyone, and you could basically go ahead and use a little bit of filler and remove this particular fold. Because the fillers are made up of hyaluronic acid, which have a high osmotic gradient, these fillers will also absorb water from the surrounding tissue over the next couple of weeks, and this fold will disappear completely. But some of these folds may not be light folds. Now, there is this patient here who's come from Bahrain, and she has a very heavy fold. If you think of the earlier patient had just a valley. This patient not only has a valley, but also has a mountain above the valley. in this patient, merely filling the valley is not going to lead to her looking younger. If you remember my first slide, the reason she has a valley, she has a mountain, is because all the fat pads from the lateral part are coming down. So essentially, you need to take the mountain up to where it used to be, which is upwards and laterally on the face. That's what we do using fillers in this particular case, and we are using a high G prime filler where we inject on the zygomatic bone like Dr. Kasturi showed, and we raise the face in this particular manner. Essentially, think of the face like a tent. The cloth of the tent has become loose, so you're raising the prongs of the tent so that the skin can become tighter. That's essentially what you're doing. And once the mountain has moved up, then you can use a lower G prime filler to sort of put it on the valley, and that's the sort of results that you can create. What's a facial thread lift? A facial thread is an outstation procedure which is done in the doctor's cabin. It's done in the doctor's office. This does not require any general or local anesthesia. Only topical anesthesia, which is prilocaine gel, can be used. And what we do essentially in this is we put in a thread. What's a thread? A thread is like the stem of a rose, and this thread actually has thorns all the way around. This engages the skin from the inside and lifts up the face. Let's see a video of how that happens. This is an outstation procedure. The results will last approximately 2 years or so, and it's a very, very simple procedure indeed. That's the thread which is being inserted with the cannula. Patient is awake, little bit of bleeding, and you will cut these threads or the edges of those right next to the skin. These remain buried. These are absorbable threads. They will disappear in due course, but while they are there, they will produce collagen and cause the face to look tighter. This works really well in this sort of a heavy face. Again, you have a mountain above and a valley below, and what you will do is you will use threads in order to tighten the face, and then this can be used to completely change the way the person looks. Certain people also come in as we age because of the facial tissues coming down. Essentially, what is happening is that our face starts to look tired and starts to look a little bit angry as well. Using fillers and threads in these patients can give a much more pleasant look, can make people look happier, can make people look a little bit more relaxed. Not everything can be performed with non-surgically, and that's why all of us train to be surgeons. And we perform the mid-face lift very commonly through the intraoral route. So in patients who have a mid-face depression, what we essentially do is we go through the superior gingival sulcus and we raise up the facial tissues so the incisions are hidden inside the mouth. And then we also have an incision behind the hairline. So you're taking 2,0-proline sutures through the malar fat pad, which is then tunneled above and tied onto the deep temporal fascia. So all the incisions are hidden. And the moment you do that, you can see the left side appears higher than the right side already. And the reason for the left side appearing higher than the right side is because you've gone ahead and repositioned the fat back to where it came from. And that's the sort of pull effect you can create. You can see how the pull is created. The results will last for 5 years easily in this short 45-minute procedure. Some more patients. This was a 68-year-old grandmom who came in from the US, and she wanted to look much more relaxed, rejuvenated, and her grandson wanted her to do something so that she looked younger. So she came in on her birthday and she wanted to look younger, and you can see that there's significant dermatochalasis. We performed a mid-face lift, upper and lower eyelid blepharoplasty and carbon dioxide laser, and that's what she looks approximately 6 weeks post the procedure. That's another patient, again a 70-year-old, who obviously was having vision restriction also because of the amount of dermatochalasis. In him as well, we've performed a mid-face lift, a blepharoplasty, and carbon dioxide laser resurfacing. That's another common procedure that we perform. When you have a double chin, etc., since all the fat is coming down, you can actually remove the fat from the neck and reposition it back to where it came from, which is from the upper face. And essentially, the moment you do that, you can actually transform the faces in this manner. Just look at how the shape of the face makes such a big impact on the way a person looks. On the left-hand side, she probably ends up looking much higher, much more heavier. She's not lost a single pound of weight, but the face looks much more elegant here. This is a 52-year-old patient in whom all of these procedures which were discussed have been performed. and that's how she looks approximately about 6 weeks later. Many people think that this is the daughter of the same lady. It's not, it's the lady herself. There are also some other things that are being developed now. Earlier, when we used to have squarish jawlines or very broad faces, we used to actually have to perform mandibular angle surgery, where we used to shave off the angle and remove a part of the masseter muscle, because when your face is so squarish, there can be multiple problems. A, you can have bruxism, so you can actually wear your enamel down by the teeth grinding all the time because of the strength of this muscle. B, because the face looks so squarish, you can end up looking a slightly less aesthetic than you would want. And what we started doing is we started using botulinum toxin. Not that we started it, there were others doing it as well, but we actually wrote a paper which showcased how much botulinum toxin needs to be injected, how many sessions need to be performed, and how many times when you perform it, the results last longer. So we actually published this paper, and you will see the difference that is created in some of these patients. Again, she's not lost a pound of weight, but her face looks much slimmer because you've been able to reduce the masseter hypertrophy using the botulinum toxin. And that's serial pictures showing how the entire thing has developed over a period of time. Some more patients. This, of course, has been published in plastic and reconstructive surgery. We now perform 60 units of the Botox on either side of the face. And once this is done 4 times, the results are almost semi-permanent, last for approximately 4 years. What could be better? Dr. Kasturi did speak about some rhinoplasty cases. We perform surgical rhinoplasty also in our practices, but the non-surgical rhinoplasty is a nice thing to do, and this is how it's done. This is how the filler is actually inserted using a cannula just below the nasal mass, and this is another part of doing it. This is below the lower lateral cartilages above the nasal dorsum that this is being done. And these are some of the results that you'll create. Look at the right light reflex. Look at the right reflex right in the center of the nose. And the moment the nose starts looking better, this should interest all the ophthalmologists in the room, the eyes start become better seen. You start noticing the eyes when there are no other facial abnormalities. So beautiful eyes, that's what you'll realize in those photographs, because the nose now is reflecting light right in a central line. And you can see how the nostrils have started to become different. We can also do threads for these. And when you put threads into the nose, you can actually lift the nose up. Again, I don't think I have time to show you procedure videos. You've already seen what threads look like. But those are the sort of results that can be created and the nose changed non-surgically. You can see how it's become much more conical from the base and how the nostrils have become much more apical as opposed to the earlier patient. Nasal humps can also be removed using fillers, and that's the before and the after, and you can see how he used to have a nasal hump out here where filler has been put in. And then some of us get a depressed tip when we are smiling. You can see that when she's smiling, she's actually got a depressed tip. Fillers and threads can actually change that. Those are almost surgical-like results from that perspective, and you can see how the nose appears to be far better now and better supported as well. So all in all, that's what I have today. Again, astonishing picture perhaps. Non-surgical rhinoplasty. This is not surgery. Many people do think that it's surgery. So all in all, this is what we do for a living. These are some of the papers which have come out of the aesthetic clinics over the past couple of years, 3 years to be precise. And moving science forwards is what we are trying to do in aesthetics. If there are any further questions, I don't think I have time for all of this, but if there are any further questions, happy to take those. Or otherwise, if you feel that you need to learn some of these, write in on an email to us. Happy to teach whatever we know. Thank you once again for your kind attention and a patient hearing. Happy to take questions for 5 minutes. Carbon dioxide laser, ma'am, we don't use it for pigmentation. Carbon dioxide laser, the scars, we would go till the basement membrane, ma'am. You can go till the basement membrane and you can treat it and you'll get very good results. The laser itself won't cross the basement membrane, which means that it will go between the epidermis and the dermis. But the good part is that it will cause collagen formation, which can make even deeper scars appear lighter.
Hello. Hello. I am told by the plastic surgeons that fillers will not last for long, and it will go off in a 1 or 2 years time. But if you want, you can the fat from your abdomen around the umbilicus can be transplanted to your face, and that will last. 50% of it will go off in a period of time of say 2 to 3 years, and then if you want, you can repeat it. So what do you think about the risks of fat transposition from another part of your body, especially if you think about pulmonary embolism?
We are into our 15th year of practice. The aesthetic clinics were set up 15 years ago. And in our 15th year of practice, we've now had the ability, or we've had the chance to see some of our patients with long-term follow-ups. Almost all of our fat patients have done badly. And it is not because of our technique. Whatever technique you use, fat is extremely unpredictable. Fat can disappear very quickly. No plastic surgeon, doesn't matter what background they come from, will ever be able to guarantee how long the fat is going to last. Second, fat is living tissue. And because fat is living tissue, the cells are living. If someday you were to put on weight, the fat cells here can form lumps. We've seen that. Granulomas are very common with fat transfers. So therefore, on the face, at least the top institutes on the planet have decided to use long-term fillers itself. And now, even with the hyaluronic acid fillers, you get results which last 2 years very predictably. There are longer-term fillers which are available, semi-permanent fillers which are available in the US, etc., which makes fillers last 5 years. Fat, you can't even guarantee 6 months, so why would we use that? With regards to your second question, with regards to pulmonary embolism, vascular problems are a problem with any sort of a medical device. Whether you're using fat, which takes up space, or using a filler, which is an injectable medical device, you could have complications with either. There are 200 plus cases of blindness which have been noted with fat and filler both, all across the planet. But when you consider that about 300 million procedures get done every year, 200 cases of blindness over the past 20 years is a drop in the ocean. So as long as we are careful, I don't think there is much to worry with fat or with filler. But because of the reasons that I have specified, we prefer filler to fat, and we don't prefer fat in our practices.
Does the skin improve with fat under the skin?
Yes and no. Skin actually improves even with fillers under the skin. When you have fillers under the skin, that also improves the texture, the turgor of skin, the way the face looks. The challenge, hi sir. The challenge is that fat has a lot of other problems. There are also people who don't inject the fat but take fibrin and actually inject platelet-rich fibrin or PRP under this thing. No evidence whatsoever that it works. Right? It is just someone saying that it worked in their patients, but if it works so beautifully in their patients, we would love to see some strong randomized controlled trials which prove the same.